Welcome to Maternal. I am Kenya Gibson, and I'm here with a very special guest in our studio today, Dr. Dawnette Lewis, MD, MPH, Director of the Center for Maternal Health at Northwell. Welcome to Maternal.
Well, thank you so much for having me, and I'm excited to be here to discuss maternal health.
Yes, we're happy to have you and hear about all the things that Northwell is doing in this space. So I want to hear a little bit how you got involved initially in the maternal health care space.
Well, I am a maternal fetal medicine physician in my day job. And so every day we take care of patients who have either high-risk pregnancies or their complications with the fetus. So basically for my entire career after residency, it's been focused on maternal health.
Wow. And you've been doing this for over 20 years.
Yes.
That's very impressive.
It's fun. I mean, I enjoy what I do.
So did you always know you were going to be in this space? Like, how did you figure out that this was the area that you wanted to work in?
I'm not sure. So I grew up, I was born in Jamaica in the West Indies, and I always wanted to be a physician. And somehow it was always obstetrics and gynecology. I don't know how I arrived at that, but, that's where, I entered the field. And I always knew I wanted to take care of women and be in women's health. And it was what was most interesting to me when I was in medical school.
That's great. And then how did you end up at Northwell?
I was having this conversation. So I did my residency in Milwaukee, Wisconsin. And then after that, I did a fellowship in maternal fetal medicine at Thomas Jefferson University. And when my parents moved here from Jamaica, we settled in the Bronx. And so New York was basically my home. And so after I was finishing fellowship, I said, my parents are older. Maybe I should move back home so I could be close to them. And Northwell was hiring. And so I interviewed there and in 2003 started working at Northwell.
That's great. I actually came across a quote from Michael Darling, who is your CEO. Yes, and it says that the risk Black women face during and after pregnancy and childbirth are a shameful illustration of the disparities that continue to diminish the well-being of our nation. How does it make you feel to hear something like that?
It's concerning because I'm a Black woman, and so It also hurts to know that when you enter the hospital or any healthcare space, that you're not treated the same as anyone else.
And then what's your positioning on the Black maternal health crisis as a whole, and why do you feel it's important for Northwell to provide solutions to Black mothers to combat this crisis?
Well, Northwell Health is an excellent health system, and I would say kudos to our CEO for recognizing that this is an issue. It's a crisis in this country. And I think Northwell itself, because of the infrastructure that it provides, it's situated perfectly to handle this crisis.
For sure. And one major solution that Northwell has come to the forefront with is the Center for Maternal Health, which you're leading. And can you share a little bit of how the center is serving families of color in the community?
Sure. So our center, it's a virtual center, and it's comprised of different entities within Northwell Health. So we have an antepartum work group, which is led by Dr. Salas Lopez in Community and Population Health. We have a peripartum work group, which is our OBGYN service line. And we also have a postpartum group, which is led by Dr. Zena Brown through Health Solutions at Northwell Health. And so because of all the assets within Northwell, we're able to provide care for patients across the continuum of their pregnancy.
That's wonderful. So it sounds like if me as a Black mom, right, if I choose Northwell as my hospital provider, I'm going to have a really good, thorough experience from, my pre-pregnancy to postpartum. It sounds like you have it all under control there.
Well, we're trying to get it under control. And, one of the things that's helping us is data. And so we have a perinatal data center that has information from 7 of our 10 birthing hospitals. And so that helps to guide some of our initiatives. And from the perinatal data center, we know that there are disparities even in our own healthcare system. And so that helps us to direct some of our initiatives and some of our programs. So for instance, we know that preeclampsia can cause complications in pregnancy. And for non-Hispanic Black patients, that rate is much higher compared to white patients. So one of the initiatives that we're doing through the center is educating patients about low-dose aspirin. So we know that taking low-dose aspirin can decrease the risk of preterm preeclampsia. And we've developed a patient-facing information card. And it says, if you have any of these risk factors, please talk to your practitioner or your provider about preeclampsia and the use of low-dose aspirin in pregnancy.
Oh, wow. That's great to know. And I see that you lead the New York State Birth Equity Improvement Project. Can you share a little bit more about what that initiative is?
Sure. So New York State recognized the disparities in outcomes for our Black birthing patients. So in New York State, Black women are 3 times more likely to die in childbirth compared to white women. And in New York City, that's 8 times. And so the state decided to form this Birth Equity Improvement Project to improve the intrapartum and postpartum experience for our Black birthing patients. And so it comprises of all birthing hospitals in New York State and the 10 birthing hospitals that North Shore is participating in the Birth Equity Improvement Project. And the state, New York State, has developed something called a PREM, which stands for a Patient Reported Experience Measure. And so patients in the postpartum period, they're asked if they want to enroll in the study and to complete the PREM. And then the state provides us with information once patients complete that to see how we can improve the delivery of care to our patients intrapartum and in the postpartum period.
That's great. And I love this 360-degree approach that Northwell takes to improving outcomes for mothers and babies. Can you tell us about your role and how you oversee all the aspects of the health system's maternal health care system?
Sure. So I help to direct all the efforts through the Center for Maternal Health, but it's using, like I said, all the assets in the healthcare system. So with Community and Population Health, they're tasked with educating all the patients that are served in the Northwell Health system. And we've developed educational campaigns, public service announcements that talk about chronic hypertension, preeclampsia, recurrent pregnancy loss. And so we're using those educational tools to educate patients about these complications in pregnancy, and that if you have any of those issues, to talk to your OBGYN provider. And if you don't have an OBGYN provider, we can help you find one to discuss those issues before you become pregnant or early in your pregnancy.
Mm-hmm. And when you go back to some of those like high risk things that can happen during pregnancy, what support systems does Northwell have in place to support someone who might be having high risk between prenatal appointments or the postpartum period at home?
Sure. So Northwell has a Mom's Navigation Program. And I think you've heard this many times because a lot of things come out of COVID. And so during the pandemic, the hospital was filled with patients who had COVID. And so after patients delivered, they were discharged early from the hospital. So typically after vaginal delivery, you would be in the hospital for 1 to 2 days. And after cesarean delivery, you'd be in the hospital for 3 to 4 days. So with COVID, patients were discharged much earlier. So after vaginal delivery, you could be home within hours of delivery. And then with a cesarean delivery, you could be home in 1 to 2 days after your delivery. So the Health Solutions, which is led by Dr. Zena Brown, they got a grant, and they had this Mom's Navigation Program. And so patients who are considered high risk, who had pregestational diabetes, chronic hypertension, any behavioral health issues, they used this program, and the program in the background, they have nurses who are able to receive calls from the patients. And what they found was that patients who used the navigation program, they were able to decrease their readmission rates overall by about 48%.
Wow.
And specifically for our Black birthing patients, we were able to decrease their readmission rate by 69%. So this program was only in the postpartum period and was just at 3 of our 10 birthing hospitals. And so what we hope to do is to expand that program to all 10 of our birthing hospitals, not just in the postpartum period, but also in the antepartum period, so that when patients enroll for prenatal care, there's a system that looks at the electronic medical record, and they'll say to a practitioner, hey, your patient is at an increased risk for preeclampsia. Speak to her about low-dose aspirin, because we know starting that early in pregnancy will decrease the risk of preterm preeclampsia.
Yeah. You also have another program called MOMS, which is Maternal Outcomes Measures. Can you tell us a little bit about that collective?
Sure. That's also in conjunction with the navigation program, that if patients are identified as having any risk during the pregnancy, that we then refer them to any specialty care that they might need. If they might need help with a cardiologist, if they have any problems with cardiovascular health. if they need a hematologist, if they have issues with any blood disorders. And sometimes we have patients who have cancer in pregnancy, and we have a cancer in pregnancy program, so the patients are referred to that program.
So when you're, dealing with moms and diverse families, right? Like, I guess what's some advice that you would give to mothers of color if they're in search for a hospital? Like, what should be on the checklist when you're making that selection so that you feel confident as a family that you're in the right place?
Yeah, it's a good question, because I think a lot of times what we hear is that patients feel like they're not heard. And I think that it's important to become educated prior to becoming pregnant, or if you have questions, make sure that you have someone who's there who's an advocate for you, and come as a family to get your questions answered. And when I was delivering patients always wanted to know, am I going to be safe in the hospital? And so when they come, we can talk to them about the initiatives that Northwell Health is doing across the healthcare system, so that they know that they're in good hands and they'll be well taken care of when they come to the health system to deliver their babies.
That's great. And they can visit beforehand, right? So they make their selection and they can get all the information they need prior to.
Sure. If someone wants to have what's called a preconception consultation prior to considering a pregnancy, or even if they're not considering a pregnancy and they want to know, how can I be healthy in the future if I want to plan a pregnancy, they can always have a consultation with a maternal fetal medicine specialist in the healthcare system.
That's great. And about how many families do you think that you're serving now with the center?
Well, Northwell, the 10 birthing hospitals that we have, we deliver about 30,000 babies a year.
Wow.
Which is about 15% of the births in New York State and 1% of the births in the nation. So we have the potential to serve all of those patients in the healthcare system.
Which makes you one of New York's largest hospital systems.
Yes.
Yeah.
Yes.
Yes. So going back to Northwell's commitment to decrease the risk that have unfairly affected Black moms and babies, what is your commitment as a physician and an advocate for maternal health?
So I think one of the things that we haven't touched on is systemic racism and institutional racism. And I think that has a lot to do with the treatment of Black patients when they come into the hospital. And I know the New York Times had recently published an article from the National Bureau of Economic Research. And the study was coming out of California, where they looked at birth data for California. And they looked at maternal and infant outcomes based on income and race. And what they found is that if you're wealthy, you tend to have better outcomes than if you're at the lower income earning group. But they found for Black patients that women who were the highest income earners who were Black had the same outcomes as patients who were in the lower income bracket who were white. And so their conclusion is that a lot of the policies that have to do with decreasing that disparity should not just focus on socioeconomic status, because an educated Black woman has definitely a worse outcome when compared to someone who's white who has a high school, less than a high school education. And where having education is protective, that's not the case for Black women. So it's important for us to make sure that all of our team members, they have implicit bias training, so that you can recognize, I think we all have our own biases, and with that training, what we hope is that that'll impact the delivery of care for our Black birthing patients.
That's great. I was going to ask you if there was a program in place for implicit bias training. We just had March of Dimes on a couple episodes ago, and they've equipped over I think it's 30,000 providers with implicit bias training. So I am happy to hear that Northwell is aligned with that, because it's just so important that people understand the biases that are there, and how as a provider, there's no one size fits all.
Absolutely.
To any demographic.
So Northwell has a Center for Equity of Care, and so they're charged with implicit bias training across the healthcare system, and they're moving towards efforts to train all their employees, because there's over, by now, probably 90,000 employees in the healthcare system, or I should say team members. And so the plan is to hopefully train all those team members. But one of the things we know is that it cannot be a one-time training. So it has to be something that's sustained. So whether that's twice a year or quarterly. That's something that hasn't been decided or planned out, but we know that it can't be just once, that it has to be something that's sustained.
That's great. So what advice would you give to Black mothers who are listening to this podcast for the first time? They're in a search for a hospital. They're in a search for equitable health care. Like, what should they be asking in terms of questions to make sure that they're getting the information and resources they need?
I think education is key. And I go back to what the patients used to ask me. They want to know, am I going to be safe in the hospital? Am I going to be taken care of? And it's also a challenge for some health systems to get the accurate information for their outcomes in terms of race, ethnicity, language, gender. So it's important to ask those questions about if I'm a first-time mom and I'm going to have a baby, what's my risk of having a cesarean delivery? Because we know having a cesarean delivery increases the rate of severe maternal morbidity. So there's an increased risk of having a blood transfusion. There's an increased risk of an ICU admission. There's an increased risk of potentially losing your uterus. And so I think it's important to ask those questions.
Yeah. I'm just thinking about some like the postpartum care, right, that's needed that goes into, after you have the baby. Are there any specific programs that you have in place that address that specifically?
We do. And, part of that program is the Mom's Navigation Program. And we're trying to expand that to all 10 of our birthing hospitals. We're also partnering with doula groups to provide some of that care. And New York State is in the process of expanding Medicaid for 1 year postpartum. So the health system, I think, can't do everything. Mm-hmm. And so part of our goal is to partner with community-based organizations that can provide some of that care in the postpartum period. And we have formed a relationship with a doula organization, and they provide health, care in the postpartum period up to 3 months. And so we're planning to continue that expansion and planning to continue establishing relationships with other community-based organizations.
That's so encouraging to hear, because it would be great to see doulas have more of a participation when it comes to mainstream healthcare.
Yes.
Yeah. And how do you see them fitting into the fold? Because I know some people don't really understand what a doula does, or like how a doula, it can be a part of that journey. So what is that like for you in terms of your insight there?
Sure. Well, I mean, a doula is not a medical profession. They're professional. They're there as a support person for the person who's in labor. So they're just there to help them, to provide any support that the patient would need. And certainly we encourage patients to talk to us about what their birth preferences are, what their wishes are when they're in labor and delivery, and hopefully we'll be able to fulfill their wishes. I think a lot of the conversations about labor and delivery needs to start early in pregnancy. So during the antepartum period, when patients are going to their provider for their healthcare visits, that there should be a lot of conversations about what should I expect when I come to the hospital, when I come to the triage area, what happens when I come. When I go into the labor and delivery room, what happens? Do I need to have an IV? Can I walk around? Will I be able to breastfeed after I deliver? Can my partner cut the cord? Or if they want to delay cord clamping, to ask, all those questions to see if their wishes are going to be fulfilled. And, sometimes we know that labor and what happens in labor and delivery, complications can arise. And to have those conversations with patients in the antepartum period, to know that, sure, we want everything to happen and to be low risk, but sometimes it's out of our hands. And so patients have to know also that things could become complicated in labor and delivery. And what we hope and what we want to do is that when those complications arise, that we're able to let the patient know what's happening, let their support person know what's happening, and so that they're constantly in the know and part of what's going on in labor and delivery, even when it becomes complicated.
That's great. And where is the center located, and how can folks connect with you all?
Well, the center, it's a virtual center, but the way to connect with the center is through our Mom's Navigation Program. And I can give you that number for anyone who's interested that they can call. So the number for our Moms Navigation Program, it's 516-918-6008. Again, that's 516-918-6008.
Perfect. And I love that it's virtual because we talk a lot of times about maternal health deserts, right,
Yes.
on this program.
Yes.
And I think that that's a big solve to women who may not have access or who they have to travel, right, so far to feel like they can have an adequate healthcare experience. So I love that you've taken that virtual model when it comes to creating a solution in this space because it's so important.
Absolutely. And we always say because of COVID. So we wouldn't have been using telehealth the way we're using it now if it wasn't for COVID. And so there are multiple ways that we can reach a patient and speak to them and provide them with the care that they need.
We appreciate that. And I love the work that you're doing in this space. And I love that Northwell is really like leading the charge because we want a place to be able to send our moms, right? So when we're having these conversations around the Black maternal health crisis, we want it to be more than just a conversation, and a way to drive down a lot of the statistical data that's out there is having solutions like this in place. So we thank you for your work.
Sure, thank you. And one of the things I should mention, I mentioned this nulliparous term, singleton vertex delivery, meaning the first-time pregnant person, the first time they're going into hospital delivering. Northwell has a plan, and they're trying to decrease that that first-time cesarean delivery rate. And because we have this perinatal data center, we have statistics on all the physicians that deliver in the hospital. And so there is an effort across the healthcare system to decrease that first-time cesarean delivery rate. And so each practitioner has a scorecard where they get quarterly, and that tells them what their nulliparous term singleton vertex delivery cesarean rate is. And if it's over 40%, then the leadership for the OBGYN service line, they talk to those practitioners about ways in which they can decrease that cesarean delivery rate. So that's, again, one of those initiatives that's going across the entire healthcare system to decrease that rate and to promote a safe vaginal delivery.
Wow, that's great. And that's very impressive. Very impressive. So I want to thank you again for joining us on Maternal. Is there anything else that you'd like to share with our audience about your personal commitment to this space of Black maternal health, or anything that Northwell it plans on contributing to this space?
Well, certainly. I mean, I'm a Black woman, and so I have my own birth story. And so I consider myself someone who is very fortunate to have, come through. And I just want to know that the work that I'm doing is meaningful and has purpose. And I'm committed to the health of our birthing moms in our hospital, and so is Northwell Health.
That's great. And we love those stories, on this platform. That's what this platform was built on, is stories of motherhood and how we can take those stories and turn a negative into a positive. So I appreciate you coming on here today and sharing your insight and sharing your journey and how you got into this space. So we thank you and we appreciate you for that.
Thank you so much for having me.
Yes, for sure. So you're listening to Maternal on iHeartRadio. Again, in studio with Dr. Dawnette Lewis, MD, MPH, Director of the Center for Maternal Health at Northwell.